Good morning, everybody. I'm hoping everybody can. Great. So I've got a message. Everybody can hear me. Thanks so much for joining us today as we gather to disseminate and discuss the recently released report entitled Laying the Groundwork for Artificial Intelligence to Advance Public Health in Canada. As those of you who were present at the two-day workshop held in Ottawa in October 2023 already know, the organization of the workshop was a collaborative effort between AI4 Health and Statistics Canada, with the Public Health Agency, Health Canada, the Canadian Health Institute for Health Information, and many academic partners attending and contributing. This report is a product of that workshop and was written collaboratively by the Public Health Agency of Canada, AI4 Health, and Statistics Canada. And we're very pleased to have so many participants tuning in from across Canada, and we're also delighted to welcome international participants from Indonesia, Iran, Ireland, Italy, Mexico, Tanzania, Uganda, and the United States. We will be dropping a link to the report in the chat here for those of you who have not had a chance to have a look at it. But first of all, let me introduce myself and my role. My name is Deirdre Hennessy, and I'm going to be the moderator for the event today. I'm a principal researcher in the Health Analysis Division at Statistics Canada. I'm an epidemiologist by training, and I joined StatCan about 14 years ago to do postdoctoral research. The primary focus of my research has been the development of microsimulation models of chronic disease, and the topics we are going to talk about today align very closely with my personal interests in open science and reproducibility, including the use of data science to better document complex models and communicate the results of modeling studies. But before we begin the main event, I would like to acknowledge the land on which I have the privilege to work and live. I live in Ottawa, Ontario, close to the Ottawa River, which is the traditional unceded territory of the Algonquin Anishinaabe people, whose presence here reaches back to time immemorial. As health researchers and others involved in the field, we recognize that there is systemic racism within and throughout our institutions, and we have the responsibility and the power to contribute culturally safe and appropriate evidence to promote community healing, health, and well-being. We respect the treaties that were made across these territories and the stewards of the lands and the waters within. We acknowledge the harms and mistakes of the past and present, and we dedicate ourselves to moving forward in partnership with Indigenous communities in a spirit of learning and collaboration. Despite the virtual nature of this event, we encourage all participants here to learn more about the traditional territories where you live and work as a starting point towards action. I also need to go over a few housekeeping details for our participants online. Please use the Zoom question and answer function to post questions, which will be moderated and directed to the panelists during the question period. It would be great if you could address your questions to specific speakers. The agenda will be posted on the one side throughout the session, and we'll try to stick to it as closely as possible. After the session, if you have additional questions, please reach out to the AI4 Health mailbox. We're going to do our best to answer questions that we didn't get to and any additional questions that you have. So now I'm going to introduce the speakers and get the event underway. We are very fortunate today to have Alyssa Strom as our discussant, and we look forward to hearing her remarks. Alyssa is the Executive Director of the Pan-Canadian Artificial Intelligence Strategy at CFAR. She works with leaders at Canada's 3 national AI institutes in Edmonton, AMI, Montreal, MILA, and Toronto, the Vector Institute, and across the country to advance Canada's leadership in AI research, training, and innovation. She's a champion of equity, diversity, and inclusion in science and an ambassador for Canada's position in AI research, innovation, and policy internationally. Alyssa is a member of the federal government's AI Advisory Council, where she co-chairs the Public Awareness Working Group and the OECD Network of Experts on AI. Next, I'm delighted to introduce our panelists, who all attended the event and contributed to the discussions that went into this report. First, I would like to welcome Chris Allison from the Public Health Agency of Canada. Chris is the Chief Data Officer and leader at the Centre for Data Management, Innovation and Analysis at the Public Health Agency. He's been working in government for 20 years across operations, policing, immigration, national security, policy, major projects, air travel, and open source collaboration. That's where I know Chris from, learning and leadership. Next, I'd like to welcome Jeff Hatcher. Jeff is the Director of the Advanced Analytics Branch at the Canadian Institutes for Health Information. Hi, Jeff. Jeff provides CIHI with technical expertise and fosters alignment, collaboration, and advancement across the organization for advanced analytics tools, methods, and techniques. Prior to joining CIHI, he spent some time at StatCan, Bell Canada, Nortel, and the Canadian Medical Protective Association. We are fortunate today to have Dan Lizotte, an associate professor at the University of Western Ontario, representing the academic community. Dan's research aims to adapt and improve reinforcement learning, machine learning, and statistical techniques so that they can be applied to new sources of health data and can in turn provide stakeholders with the best available evidence for non-myopic health decision-making. And our final panel member is Claudia San Martin. Claudia is the Director General of the Analytical Studies and Modelling Branch at Statistics Canada. The branch is the research and modelling hub of the agency and is responsible for delivering a range of data access solutions as well as data literacy training. Claudia has played an active role in conducting research and developing new data sources to meet emerging information needs in the area of population health modelling, healthcare, and health systems performance. The final speaker I want to introduce, and the first on our agenda today, is Laura Rosella. Laura is one of the driving forces behind AI4Public Health, which has the goal to establish a workforce of public health researchers and practitioners who develop and apply innovations in equitable artificial intelligence and machine learning to public health research, policy, and practice in Canada. She is also a professor at the Dalla Lana School of Public Health, holds the Canada Research Chair in Population Health Analytics, and leads the Population Health Analytics Lab at the University of Toronto. Laura is going to open the event by providing us with an overview of the report and setting the context for our conversation. Laura, I'm very pleased to hand the spotlight to you.
Thank you very much for that kind introduction. I'm going to share my screen, just make sure. How's that looking to everyone? Good? Okay, I'm going to go ahead and kick us off. Thank you all so much for attending. We are so thrilled to be having this conversation. And a very special thank you to all the panelists who have made the time to be here today. We're at our workshop, but also dedicate so much of their time and energy in making sure that we are as set up as we can be to advance all data science applications for public health and all health applications in Canada. I'm really looking forward to our discussion. My job for these first few minutes is just to summarize the report and the workshop, give some context to the conversation we're about to have, which I'm very excited about. So everybody's talking about AI. We're certainly talking about it quite a bit. And we know that data and analytics are being used more now than ever at any point in history. We have more data than we ever have before, and we're using it in much more sophisticated way. AI technologies are transforming almost every sector in society. And of course, health is one of those sectors, and specifically public health. We're at this tipping point where the time to define what AI means for public health is now. We don't want AI to happen to us. We want to be part of defining how we're using it responsibly and ethically and for public health impact. So as was mentioned, a couple years ago, we started this health research training platform dedicated to establishing a workforce of public health researchers and practitioners who develop and apply innovations in equitable AI for public health research, policy, and practice in Canada. And we've been working on this mission for a few years and very pleased to see the progress that we're seeing and how we are able to shape AI and how it's used for public health in Canada. We know that public health is constantly challenged. The challenges are becoming more complex, and they're growing. And just a few listed here: widening disparities, challenges due to climate change. And our system is increasingly strained. In a way, we're asked to deal with more with less resources. And that's a constant source of stress. Of course, coming out of the pandemic, many individuals working in public health realize just how stretched we are. The data landscape is also changing quite a bit. I mentioned at the beginning that we have more data than we ever have. We also have different types of data. So we have data infrastructure that is somewhat set up, although not ideal, for data that we had 30, 40 years ago. The data we have now, the data streams, the complexity of those streams, the issues regarding data quality that need to be dealt with are all new. And so that's the context of a sector that uses data to drive almost all of its work, from surveillance to interventions to program evaluation. Data is at the center of all of it. And as I mentioned, our system is increasingly strained. So there's an opportunity here for some of the advances that we're seeing, but we're not quite set up to realize them fully. There are examples, of course, of how AI is being applied in public health. Some examples listed here. We're seeing a lot of innovation in how we do exposure assessment from environmental images, for example. We're seeing a lot of innovation in the surveillance space, new ways to do population risk stratification, chatbots, back-end administrative tasks. But these examples are happening in pockets, not necessarily coordinated. There's lots of concerns, and there's lots of capacity gaps in the system. So not everybody who works in public health is being able to engage in some of these technologies where beneficial, or have a say in how they should be used and for what purpose. We're seeing these applications again across the spectrum. So surveillance, I mentioned, describing what's happening, predicting what will happen, why things happen, and what we should do about it. All of these functions are functions that are core to public health practice. And lastly, before I just talk about our workshop, we like to ensure that we're always anchoring every conversation we're having about AI and public health and in the impact that we're intending to have. At the end of the day, these technologies are powerful, they're important, they have a role in addressing all those key challenges I listed at the beginning, but we have to ensure that they, if successful, they are helping us prevent disease, promote health, and reduce health inequities. And we're not quite at the point where we can confidently say that. That's part of our discussion today. How do we build the evidence to ensure that these technologies and these capabilities are helping us achieve our goals in public health? So we were very fortunate to come together with Statistics Canada. And I want to recognize the leadership of Claudia St. Martin, who you'll hear about, and many others at Statistics Canada who have been working very hard to say, we know this is important, and we need to start thinking about all the aspects to make this happen in a way that we know will support population and public health. So we came together to host this national workshop called Connection and Understanding around National Data, AI, and Public Health. And I'm going to give you a brief summary of what those 2 days were like, and of course, the report that came after, which serves as a launching point for our discussion today. As was mentioned, we had partners from across federal and national agencies. In particular, I want to just mention Health Canada, CIHI, Public Health Agency of Canada, who really recognize the importance of continuing the conversation, and is actually the reason why we're having this event here today. We didn't want to just stop at that one workshop. Public Health Agency of Canada really said, how do we keep this going for Canadians and to ensure our public health workforce is engaged in this conversation? We also had a lot of representation from our academic partners, and this is really important because a lot of the innovations and training is happening in our universities across Canada. And so we had these really great conversations with all of these different individuals from these organizations in the room, and I'll tell you a little bit more about them. I also want to emphasize that we had our AI for Public Health Community Advisory Board part of these conversations. So AI for Public Health has a community advisory board. These are tremendous individuals from across Canada that are working with us on our platform, on all of our training programs, to ensure community voices are integrated, not just into AI applications, but actually how we even think about articulating AI for public health. And so those voices in the workshop and actually across our platform and everything we do are really critical to shaping trust and responsible AI for public health. So our objectives, what did we set out to do in these couple days? So the first thing was about connection. There is amazing work happening in our federal departments, in our national organizations, and in our academic settings across this country that are very useful for public health. Innovations, responsible AI, thinking about ways to build trust with community, but it's happening in silos. We've noticed this as a platform because we happen to interact with all people across all these settings working in these different contexts. And we really wanted to just have a moment to come together and share experiences and build those connections. So that was our first objective. We want to talk about where applications could have the greatest impact. I want to acknowledge Professor Lizotte, who led an amazing workshop a couple years ago that brought public health practitioners to the table and said, tell us what your needs are. And the AI researchers were listening. And we want to further those conversations because a lot of the applications that are being built are technically very sophisticated and impressive, but may not be addressing a need. So we want to close that gap. Of course, we want to learn from each other. We did a lot of that and talk about what are our shared frustrations, but also our successes. We also want to talk about training and capacity building. There is a need across all the organizations represented to build new capacity. This is a field that's changing very quickly, weekly, monthly. How do we keep up? And of course, when we go from here, where can we strengthen these partnerships in a meaningful way so they're fostered beyond the days of our workshop? So we structured our dialogues and our sections into data, people, and partnerships. And so we had lots of engagement sections around all of these. And I'm going to just summarize 4 themes that came from these dialogues to give you a sense of what's in the report. We've also made sure the report's very accessible and easy to read, so it can be a starting point of conversation for solutions. So these 4 themes I'll just briefly touch upon now, leading into our panel discussion. The first theme, no surprise, is around data and infrastructure. Our discussions reveal challenges around data availability, access, standards, and quality. All things we've heard before, all things articulated in the CFAR AI strategy, in the Pan-Canadian data strategy, in a few reports before that. Our recommendations were about moving forward in a way that's building new infrastructure. If data is at the core of all of these AI technologies, in some ways you can literally think of it as a life-saving, life-promoting element, having high-quality, effective data. If the AI technologies that are coming from them are resulting in health benefits, we need to have infrastructure that's built for that purpose. Not necessarily tweaking infrastructure that exists, but actually building data infrastructure for the data streams I mentioned at the beginning of the slide. We are in a new era of data, and we need the infrastructure to be able to handle that. And we need to start focusing on high quality data, linkages across data streams, and ensuring that we're not just drawing upon a single data source. We need data from that covers the social, ecological model of health. That's how we think about it in public health. And we're finally at a stage where we can start doing that because we can extract that data from multiple streams. The next theme is around skills and training. And the challenges that came up were challenges around technical skills. How do we ensure that we can stay up to date technically with all of this technology? But also, how do we build multidisciplinary teams that can actually enable all the elements that make AI happen? It's much more than just the technical aspects of these methodologies. It's about implementation science. It's about responsible and ethical oversight. It's about domain expertise. So actually, to deploy these technologies, you need that full spectrum. And so we talked about a lot of practical strategies of developing expertise, upskilling our workforce. In fact, one of the biggest takeaways I have from sitting in the room is how much amazing work is already happening in these organizations, and the sharing that was going on about the way that they're adapting their workforce to be able to engage in these methods. The third theme around collaboration. And one thing that was clear, and again has been articulated in other reports, is that there is a lack of interorganizational cooperation and partnership, including across institutions, government organizations, and also with academic partnerships. And this is not because people do not want these partnerships. Everybody sees the value of them. When they do happen, usually ad hoc, there happens to be a grant that enables it or some opportunity that enables the funding, they're hugely valuable. But it's not sustained in a way that enable this to continue throughout. And so that was the big gap that we noticed. And we know that this work will not happen without partnerships. The partnerships, bringing together people thinking about this problem from different perspectives with different strengths, means better solution, diversity in how we're thinking about it, a sense of a shared commitment and a distribution of the lift. It's a huge lift. It's actually overwhelming at times, thinking about the changes that are coming down the line with the pace at which AI technology is developing. But if we're sharing in that together and distributing that across our organizations that are full of talented individuals and really strong institutional support, it can seem less daunting. And so fostering that became a very clear theme. And lastly, all aspects around equity, trust, responsible AI. There are lots of concerns, challenges around algorithmic bias, ethical challenges, mistrust in the system. What was clear from our conversations here were that this is not a singular approach. And we have our, I have the picture here of our layers of protection, which is an analogy we really love using in public health. It's not one thing that's going to ensure we have equitable and responsible AI adoption that will actually achieve our goals in public health. There will need to be regulation. There needs to be standards. There needs to be oversight, and there needs to be co-creation and engagement with community and practitioners, among others. There are many layers to this. But what was clear is that until we build this safety system and its multiple components, we can't really proceed. There are too many unknowns. There's too much risk. And so we need to start putting these building blocks in place in a really meaningful way. So the report has various recommendations. You will see the recommendations in the report. I've touched on many of them. I just want to highlight a few other things that came out. One is ensuring that we're actually building the applications that are distinct from healthcare. They are complementary and closely related. A high-functioning health system recognizes the important role of public health, but some of the applications for individual clinical use are distinct. So that's something that needs to be teased out. And the responsible use needs to be about maintaining ethical, equitable, and methodological standards. There's a lot of really, really good, thoughtful work underway that needs to be implemented, especially around standards. They are coming out and they're very good. They're very, very thoughtful. They're coming from lots of different international organizations as well as within Canada. And we want to talk about how we implement these. So I'm just going to end by saying that we really believe that AI is changing our society all around us, but that what we do in health and in public health actually can add value to those shifts at a societal level. We think about preventing and promoting health in our communities, reducing health inequities, data, reducing bias, data standards, these are all things that are fundamentally part of our DNA in public health for hundreds of years. And so the more we engage in this conversation, the better the benefits, not just for health and public health, but for all of society. And so I'll ask the panel and everyone today to reflect on what we found. I'm sure many of this resonates. Some of it may not have captured where you're thinking. We'd love to hear about you, but move towards a space of action. Now that we have this consensus, now that we have this information from lots of excellent thought leaders in this space, including many people on this call today, where can we start practically to make a change to enable Canada as a leader in this space and also prepared for the challenges that we're dealing with in public health? So thank you all for the opportunity. Very much looking forward to all of your insights, and I'll pass it off back to you, Deirdre.
Thank you very much, Laura. Thanks so much for that inspirational message there, and for setting the context and outlining up for us the real potential benefits of harnessing AI for public health, as well as summarizing the themes and recommendations that emerged from the workshop and report, but reminding us that we still have some work to do to maintain and grow those connections that we established at that time. So next, I'm going to welcome our guest discussant, Alyssa Strom, to provide her feedback on the information that we gathered in the report. Alyssa, I'm very pleased to hand the mic to you.
Thank you very much, Deirdre. Bonjour à toutes et à tous. C'est un grand plaisir d'être ici avec vous aujourd'hui. Hello, everyone. It's great to be with you here today. I'm really excited about this report, and particularly this conversation that we're having today. I was very sorry to have missed the workshop. I wasn't able to attend. I was out of the country at the time. And I would say now, after digging into the report and the recommendations and hearing Laura's presentation, I'm even more sorry that I missed it, but I do feel like the report has done a wonderful justice to the conversations that were had and the time and effort and ideas that emerged from the meeting. I'll echo the thanks and kudos to the organizers of the workshop and all of the participants, and to the report writers. I feel that this report is really a huge contribution to the body of work, really, across Canada and over the years, in understanding how AI can be applied to advance better health for Canadians, and particularly, of course, to advance better public health in Canada. So let me start my remarks by just sharing a little bit about why I think the report is so important and this work is so important. For me, the opportunity to deploy AI around questions of health is really a critical one. For me personally. It's an area that I think there's a tremendous opportunity, an area where AI can really, really benefit our society as a whole, and of course, individuals. And it's actually one of the driving forces for me, the reason why I'm in this field, the reason why I work with so many colleagues and partners across the country to think about these issues and try to break down some barriers and move towards action. Because I think that across all of the many, many, many diverse applications of AI, we see so many of them that are, purely commercial in nature or entertainment in nature. The opportunity to apply AI to deliver better health care, and improve lives, save lives, is really something that I'm very passionate about. So I've been the executive director of the Pan-Canadian AI strategy since 2018, and AI for health has been one of our strategic priorities from the very beginning. In 2019 and 2020 at CFAR, we organized a national task force on AI for health, and we brought together leaders and experts from across the country, across disciplines and domains, lots of different expertise, and we also ran town hall conversations across the country on the opportunity for Canada. And the results of our work really demonstrated that Canada has a particularly unique opportunity to develop and deploy AI within health and really, across Canada and for the world. And it's our tremendous expertise that we have in machine learning, research and innovation. Of course, our tremendous expertise that we have in um, uh, life sciences and healthcare research and innovation. But there are also tremendous assets in Canada, strengths that are unique to Canada that really position us well to be able to use AI for health applications. And one of those is, in fact, the diversity of our country, the fact that we are a country of immigrants, that we have so much diversity, which really ensures that the data that we're building our AI for health applications on is really representative of quite a heterogeneous population. And those are the best kinds of AI applications that we can find. So our task force report laid out a series of recommendations as well. And we really, when the co-authors and I finished putting our final crossing of T's and dotting of I's onto the report on March 12th, 2020. And then the world changed very significantly. And so we put our recommendations aside for a few months and eventually sent them out into the world and worked really hard through the pandemic. So many leaders across Canada to deploy data science and technology to help understand and mitigate the effects of the pandemic. And I would say the recommendations from the report have sort of been, deployed in a lot of different ways. They were very, very well received. We now have a national pan-Canadian health data strategy that comes out of that some early work. We now have today's report, but I'm still sort of waiting for that opportunity to really move the needle on the applications of AI for health. And I have to say that I think that public health presents that opportunity for us in Canada. And so that's why I'm so excited about this work and about where we can go. There's already been, as Laura said, there's already a lot of work happening across Canada. Many, many researchers working on this space, many government agencies working on this space, many collaborations at CFAR. We've had collaborations with CIHR on this, with the Wellcome Trust. We have a solution network working to advance AI for public health, particularly in diabetes, that Laura is one of the co-directors of. But as Laura also described, these are various and fragmented, uncoordinated sort of pilot projects happening all across the country. And so what we need in Canada and what the report, I think, identifies is much greater level of coordination and collaboration. And I'll be the first to say, or maybe the second right after Laura, to say now is the time for action, right? We've been talking about this, we've been exploring it, we've been piloting it. It's now time for us to take a bold next step. So let me just share a little bit of what I loved about the report. And again, my comments will focus on those major themes that emerged in the discussion that Laura also identified in her presentation. And so I really appreciated all of the recommendations of the report. And I think that there are some that we can tackle more quickly and more easily than others. And there are some that are harder and longer term, but in fact, we should be tackling them all. So starting with data, it really is the biggest barrier to the adoption of AI in any health or healthcare application or in public health. We know that this is a problem. There are quite a few initiatives really trying to address it. There are great initiatives that are actually overcoming this barrier and rising above it. So HDRN is one great example of that. But there are also plenty of examples, in provinces where in particular provinces where the data is in much better shape, is much more accessible, is much more curated than in others. And I'm thinking of Alberta, for instance. Alberta Health Services has a comprehensive whole of population health data repository. And that's a huge asset for us as a country that isn't accessible right now because of privacy limitations and really strict restrictions on who and when and how it can be used. But that's an asset that we have to find ways to unlock. Likewise, Nova Scotia is building a one patient, one record electronic health record system across the whole province. And this, again, provides a huge opportunity for public health research and innovation and the application of AI. So let's think about using those great examples that we have already across the country, leveraging those great data sources. Absolutely, I agree with you, Laura, that we need to build, and we need to build data infrastructure that serves the 21st century and the needs of AI. But let's see if we can leverage what we already have. On people, I really, really love the focus on people, on upskilling, on building multidisciplinary teams. It's certainly how we approach all of our work at CFAR. We really believe that by bringing people together with different expertise, different experience, different lived experience, that's how you can arrive at the most innovative solutions and realize the most meaningful breakthroughs. So multidisciplinarity, I think, will be essential here. The report talks about the need to develop deeper technical expertise among public health professionals. I think one thing that's a corollary to that is the need to develop public health expertise among computer scientists and machine learning experts. And I think that give and take of information and knowledge actually goes both ways. And that's how we build really strong multidisciplinary teams. There's definitely a lot of programs and opportunities at our national AI institutes for upskilling, and especially, for instance, at the leadership level, where we really want people to understand the strategic and policy opportunities around AI. And when we think about how do we recruit technical expertise into the public health domain, I think the most important thing is that our technical experts are looking for a really meaningful and challenging technical problem to dig into. And I think that public health presents exactly the kinds of challenges that they'll be interested in. So there's quite a lot of hope there. I loved on partnerships and engagement. I loved the recognition and how strongly it was called out that we need to advance collaboration across academia, government, and between national AI agencies. There are definitely some interesting mechanisms that we should be exploring here. The idea of seconding faculty into government was very, very interesting. I also thought about what about having joint and shared postdoctoral fellows, right, that pass between academia and government health, public health agencies. Can we be putting those postdocs to work in really applied challenges and problems to take this work further? One of the last areas that I want to speak about is the discussion around community engagement and building trust. Though this is absolutely essential to any successful deployment of an AI application. Here, I think we need to go one step further. One of the ideas that's really emerging in work that we're doing across CFAR around how to build and deploy really meaningful and responsible AI systems, across many different domains and applications, is a principle of not just community engagement, but community-led design. So really integrating those members of the community who will be users of the technology, who will be directly impacted by the technology, embedding them into the process from the very beginning, and including them really as collaborators as we design and develop and deploy AI systems. And the CFAR Solution Network that Laura is a co-director of is actually one example of where at CFAR we are embarking on those kinds of practices. And we have another solution network called Data Communities for Inclusion that does the same thing. I loved the inclusion of the community advisory board members at the meeting, but I want us to ask ourselves, can we do more? Could we do more? How can we take engagement to the next level and put the community at the heart of the design phase? So in conclusion, I want to thank everyone who contributed to this work. It really does take us that next step forward. I think there are a series of really important recommendations in the report, but a key question that I am left with is who is responsible for making this happen? Who is responsible for acting on these recommendations? They're quite diverse in their makeup. They're tackling different aspects of the challenge of deploying AI within public health. But All that being said, I think that the most effective way to bring these recommendations to life and to act upon them is to do it all under one comprehensive shared vision. We need a place that brings together the key collaborators to advance this work. And to do that, we need leadership and we need funding. We need a really, really strong vision that so many different people from different domains and expertise and sectors can get behind and help to work on. So my most important message is now is the time for action. We've been talking about this for a long time. We've been talking about AI for health for a long time, and I'm ready to act. And I know that many of you are as well. The barriers that we see to the deployment of AI in public health are not technical. They're about infrastructure, they're about policy, they're about collaboration. We need to tackle all of those barriers with a goal of coordinating and achieving scale of public health applications across Canada. We don't have the funding in place right now to do this work specifically, but we have to do it anyways. And I think we have to start by building something that could actually be funded. I would suggest that we need to use the mechanisms that are already available to us to demonstrate how strong those collaborations between academia and government and the community can be. So where do we begin? This is my one bold step, my suggestion. I think we should build an AI for Public Health Leadership Council. And this will be a group of like-minded individuals that come together, start prioritizing, excuse me, and identifying these key stakeholders and opportunities that can bring these recommendations to life. We need to come together and get on with this work. And so I'll thank the organizers for the opportunity to share my thoughts. It's really a privilege to do so, and I very much look forward to the conversation. Thank you.
Thanks so much, Alyssa, for those very thoughtful remarks and, for making the recommendations quite concrete for us, I think, in the health space. I know as a group, we hope that bringing these issues forward in the report would help us discover some of the pain points that we've been talking about and then start to work on easing them. But thanks for your encouragement and linking this report back to the previous CFAR work, and also for providing these solid examples of best practices for advancing the work that are going on around Canada. Now I'm going to turn to the panel. I would like to get their thoughts on what they've just heard from Alyssa, as well as Laura, and on the report and the event more generally. So first up, we're going to have Chris Allison from the Public Health Agency. Over to you, Chris. I'm very interested in hearing your thoughts.
Thanks so much, Deidre, and thank you so much for the amazing comments and opening that we had here from Laura and Alyssa. I love the report. I think this is a really important piece of work for us to do to start to organize. And I was in a different table very recently, and the focus was how do we agree to agree on what it is that we need to do and on how to move forward. And I really think the report and this follow-up is a really important step in that. How are we coming together across sectors to figure out the key, very practical things that we can do and make happen. I'm going to take a little tour, and then I'm going to come back to that though. In that we heard from Laura, things are changing on a weekly or monthly basis in AI. So part of what I was thinking about coming into this is what has changed in the past 7 months, right? From October to May, right? Almost exactly, sorry, yeah. 7 months. So within the public health agency, the answer is a lot, right? There is more interest. There was interest back in October. There's more now. There's more hype in the system. But we've also seen major systemic changes as well. We've seen a $2 billion investment to fuel AI innovation in Canada that is starting to roll out. We've seen across government departments multiple artificial intelligence strategies, more pilots being scaled across our organizations, more sharing of tools, open source platforms. So this kind of work is happening all over the place. Learning and awareness as well. Within the Public Health Agency, we've developed a concept paper on artificial intelligence in public health, infographics to help our own people and other jurisdictions understand what's going on. And coming from the Chief Data Officer lens, artificial intelligence is one of 4 priority areas for the group to focus on, like figure out how we actually develop kind of core things over the course of the year. From a technical perspective, our National Microbiological Laboratory is working on to use AI from genomic sequencing data of foodborne pathogens to predict antibiotic resistance, which is one of like the top public health, like looming existential threats that we're facing. Doing amazing work with synthetic data using an open platform called Cynthia to actually develop synthetic patient populations on which we can plan and test and see how might a federated analytic system work that actually did connect provinces and territories together and with the federal government in a way that really protects privacy. Amazing work on signal detection, right? Mass clustering using large language models to give a Q&A based ability on massive corpuses of news knowledge and connecting that to geocoded data as well. And more and more. We've probably got about a dozen projects happening within the Public Health Agency. Another big thing, though, is there's more and more questions and a very strong commitment to making sure that as we're thinking about these things, we are actually also focusing on Indigenous data sovereignty principles in this work. And in Canada, I think we have massive diversity, as was mentioned, in terms of our population, our geography, but we also really have to think about how the massive amounts of data that are being gathered and pulled together to drive, create, train, and evolve these models impacts our Indigenous communities, right? And their rights and their kind of need to move towards self-governance. For public health professionals, this is a lot of change, right? There's a lot of new tools coming out. There's a lot of questions on what could happen here and how to use it. The good news is, like, a lot of these things are being commercialized and they're being driven in a way that is easier to use, but I would counter to say it's harder to understand, right? When an epi or a public health professional is doing their analysis, they understand where it's come from, where they're going. These models are, in a large extent, not transparent. And there's not a strong driver yet in the private sector to make them transparent. And I think that's one of the things that potentially this group that was mentioned previously might be looking into. Huge potential for artificial intelligence. That's been covered really, really well in report. On the challenges, I think one of the things I'd like to frame is, and it's been mentioned, like artificial intelligence is shaping our society, and it's shaping and potentially will start having impacts, visible impacts soon on public health. So we have I'd say a responsibility to think, like, what do we want? What do we need for our society? What does a healthy society actually look like? And start taking that lens when we're thinking about AI. So there's all of the things we need to do to kind of get ahead and to use it within the public health space. As we're doing it, we need to consider these things. But I also think from a broader perspective, there's a huge need for us to think about regulation. The EU actually today launched their legislation governing the use of artificial intelligence in large language models. Or sorry, maybe it was yesterday, but anyway, like yesterday, today, which actually looks at classifying the use of artificial intelligence into different categories, higher and lower risk, strictly regulating things like artificial intelligence used to modify human behavior, predictive analytics for policing, right? Like there's a number of things there, and tying inappropriate use of this to penalties as a percentage of the gross income, revenue streams of organizations that are doing this. So that's a very interesting space for us to watch. But when we're looking at the impacts of AI generated art, that means like artists can't sell art, right? AI generated text, more low value or derivative content. Google looking to use AI to create content instead of forwarding you to human generated content on the web, right? They've got a Q&A setup happening right now where what's the result of that over the course of time, and how does that affect open data and open science and a lot of the foundational pieces that have allowed us to come together? So these just very high level things that I think we do need to deal with. But I think for us now, and going back to the report, we have so much potential, right? We have an energy here that's come out of these conversations and the hard work from people behind the scenes to move it together. We have you here joining us today. I know there's more than 1,000 people that signed up and registered to this session. So there's so much interest in this. And I think we can use the hype. We can use the different considerations in society to really focus activity, right? To really do something concrete together. I love the idea of the council coming together. But if I can, I'm going to yes and Alyssa and say, what would a concrete, practical use case, like a technical use case for AI that supports not just one part, but that supports a public health ecosystem? It supports provinces and territories. It supports the needs at the federal level, and it supports communities and includes kind of Indigenous data sovereignty as part of it. Like, what could that look like, and how might we move it forward? So I'll close it there, but thank you so much for having me.
Thanks, Chris, for your perspective. It's really great to hear that the Public Health Agency are pushing forward on many of these issues. Next, I'm going to go to Jeff Hatcher from CIHI. Jeff, would you like to share some of your thoughts?
For sure. Good morning, everyone. Certainly, and yeah, it was great to be involved in the workshop last fall, and a pleasure certainly reading the report and being involved in this webinar here today. And certainly, as I read through the report, it was trying to situate it in the context of my organization, the Canadian Institute for Health Information. And certainly, thinking about the priorities and the challenges and the opportunities, and I'll just try and, say a few words on each of those. And certainly the data theme is a priority, very prominent in the report. When we think about data, the quality, the comprehensiveness, accessibility, and certainly that's been mentioned by speakers already this morning. And certainly a priority for CIHI, and we certainly have some strategic projects underway on health data transformation. There's been some mention already this morning around standards. So that's a big area for us right now. We've got a strategic initiative underway around standards and must-have content from across all providers, across all sectors, public health included, and also, a little bit more futuristically, maybe starting to think about social care data, environmental data, and going beyond the health sector itself. So as part of that data transformation, of course, timelier and richer data, and we all witnessed, certainly during the pandemic, that access to near time or real time data was a huge challenge for us, CIHI included. We want to make sure that in that health data transformation, we've got pan-Canadian consistency around the quality of that data and the accessibility of it. Certainly, part of our role as an organization, CIHI, is providing access to data to researchers, and certainly, faster access. Something we hear over and over again, and we're having some initiatives, to try and move that forward. Also thinking about AI upskilling has also been mentioned, as a key theme in the report. Access, AI upskilling for all of our staff. I would say that's something we're working on right now, something under development. Thinking about, with our data, some of our challenges right now are the biggest one, I would say, and this is nothing new to us, is data requests that come to CIHI from researchers. There's been some challenges around turnaround, more so lately, because they're becoming more increasingly becoming complex, involving linkages across sectors, and it's challenging to ensure that we have de-identification and protection of patient privacy before we allow accessibility to that data set. And that's something that we need to address. And I'll speak a little bit more in terms of, what some of the opportunities might be around that. Certainly when we think about some of the themes in the report, some of the mention this morning around, data and infrastructure, a big challenge for our organization, as many organizations on shore, is around limited resources and other competing priorities, and not just strategic projects, but also operations. When I think about our staff, what some of the challenges are going forward and what some of the concerns may be, are, people are going to be wondering, and we need to ensure that we be thoughtful around what work will AI replace, and what AI, as AI systems start to get put into place, will AI leave people behind potentially? And will AI change our expectations of proficiency and performance of our staff? And certainly when we think about, as we develop AI systems, machine learning models, and deploy them out into the ecosystem for use in public health or others, we need to start to think about, one of the challenges is going to be around the computer intensiveness of the model development and the production, both from time and money. It's difficult for small organizations to take that on, especially, some of these technologies and algorithms, very CPU intensive. You see mentioned in the report around access to GPUs. These are not cheap. And we also need to think about, what is the carbon footprint of all this work, right? And be thoughtful and ethical in the work that we do. So again, collaboration, I think, is going to be a key piece around that, right? Also, when we think about when we develop and deploy these models out into the ecosystem, we're going to need to think about not just the technology, not just the algorithm, not just the risk score. We're going to think about, redefining the processes and the tasks with AI in the loop. And is it autonomous, or is it something that's there to assist the humans, right? And we'll need to ensure that we've got governance in place to ensure that these AI systems are accurate, unbiased, trustworthy, explainable, safe, and that we have, no unintended consequences, and that we don't exacerbate any of the inequities and disparities that are already in the system. And when I think about as well opportunities, around data, currently one thing we have underway right now is exploring and testing data synthesization and use of synthetic data for various use cases. And we're looking at it from a technical perspective, but also from a governance perspective. Large language models, Chris has mentioned them already. We see a lot of potential here. Collaborations, we have, CIHR Health System Impact Fellow that's with us for 2 years from University of Waterloo, and just joined us. We also have a co-op student from Waterloo that's also working on synthetic data. And we also have an interest in exploring other privacy enhancing technologies and their potential in protecting data and making it more accessible. And as well, we've just recently started exploring use of machine learning techniques for outlier detection, detection of data anomalies, and as part of our data cleaning processes. So just to close off, Laura threw out there, one bold step, one concrete action. I would say that the thing that that I would like to see some focus on is more around from data accessibility. And the use of technologies, privacy enhancing technologies that we have available, and modernizing our policies around protection of data, data privacy, to ensure that we've got better access by researchers and other public organizations to this data and for the public good. Over to you, Deirdre.
Thanks so much for that, Jeff, and for sharing some of the real challenges that data organizations face. I think it's really important to keep those in mind. So next, I'm very pleased to hand the spotlight to Dan Lizotte from Western University. Dan's our representative from academia on the panel. Dan, I'm very interested to hear your perspective.
Thanks, Deirdre. Thanks very much. Thanks for the opportunity to represent all of academia. I'm going to do my best. So. I think what I'd like to do is maybe steer away from some of the more technical topics. So just a tiny bit about me. I am appointed here at Western in computer science, but also in our Master of Public Health program, and I teach in both. And so I want to have a conversation about interdisciplinarity and kind of the roles that universities might take on in response to what we learned. So Alyssa pointed out that while if you look at the title of the report, you might get the impression that it is very technically focused, but there are a lot of really important and great points made about people and partnerships and relationships. And so that's what I'd like to discuss first. So I think when I think about what the possible roles are for universities in this space, an obvious one is to be doing research and to be following what might have been called at one point a model of knowledge translation, where the research sort of happens and it sort of flows into practice like a river. I think that sort of was a reasonable model and is a reasonable model for some kinds of things, but I think that especially for AI and public health, a model that's more like bringing people together and doing work together. By that, I mean researchers and practitioners might be more fruitful. So I think universities as conveners, I think, is a good way of thinking about the value that we can bring to this conversation. And I think the October workshop was a prime example of this. And the report coming out, I think, is a great success. Other ways we might convene, I mean, we can organize these kinds of meetings and open these dialogues, which I think is an important function. When another approach, and Alyssa alluded to this as well, is having trainees really serve as conduits who are able to move between the worlds of academia and research and practice. And this is a longstanding, I mean, if you talk to folks in academia and you ask them what they need to start a collaboration, they will say, I want a student or a postdoc or some kind of trainee. So trainees are crucial and wonderful ways of creating those connections. And so I think one of Alyssa's other comments about, it's not exclusively about, cannot exclusively be about, let's say, health-oriented folks learning about technical disciplines. It has to be a coming together from both sides and a learning together in order to really both create those connections, move projects forward, and at the same time build capacity. So it's kind of a twofer. The other idea that can come under the umbrella of convening, I think, is the phrase having the community at the heart of the design phase of any initiatives that we're undertaking. And I'll just note that that's not unique to AI. That is a principle that we try to uphold in public health, no matter what it is we're doing. And there is also an opportunity for universities, I think, to facilitate that kind of coming together with community as well. So I think overall, developing and maintaining partnerships should be a critical activity for universities and academics working in this space. And then I think another natural area of focus is training initiatives, which is maybe a bit obvious, but I think important to say. And that can be, when we think about trainees, classically, we think about maybe students, postdocs, maybe we're also thinking about professionals and practitioners who are working to expand their knowledge base to be able to expand what they're able to do, which is great. But I think that, researchers are also learners in this space because of this new interdisciplinary mode that we're bringing. And so models of training that range from maybe classic, very in-depth graduate training, for example, PhDs in joint disciplines of computer science and public health, but also much more accessible and targeted and efficient ways about learning specific new topics, like the short courses that are offered by AI4PH, are both important ways of thinking about how we can do that capacity building, which is really at the core mission of universities as it is. And I just think that, if there's a message that comes out from the report, it's yet another signal to academia that we need to be thinking more about the importance of multi-transdisciplinarity and experiential learning, where trainees are getting experience out in the world. And so I'll just, the thing that I would really like to have, so I'll see Alyssa's leadership consortium and raise you a national but geographically distributed Institute for Public Health AI research and practice, where we can do that convening and training.
Thanks so much, Dan. We're happy that the report gave us the opportunity to highlight the real importance of people and relationships in this space, and thanks for bringing that up. I appreciate your thoughts. Our final panelist is Claudia San Martin from Statistics Canada. Claudia, what has resonated with you through attending the event, being involved with the report, and hearing Laura's and Alyssa's call for action today?
Yeah, thanks a lot, Deirdre. So first of all, I just wanted to thank Laura for her leadership and the team at AI for Public Health and including us in this great initiative. And I will say that the opportunity to connect with partners in October in person, I think that was one of the few in person, was really valuable for exactly what the reason Laura said is there's a lot of great work going on across federal departments, Public Health Agency, Health Canada, ourselves, and organizations like CIHI, but also in academia. So a lot of great connections were made. And of course, this report and recommendations. I guess maybe what I'll do is just touch on a few areas in which as StatCan, we're hopefully contributing where we see some of the challenges in terms of moving forward on some of these key areas. And I do just want to start with data, which I guess is occupational hazard given where we sit, but that is what we live, eat, and breathe every day at StatCan. And, I think where we have made tremendous gains, Statistics Canada, but in partnership with organizations like CIHI, is the bringing together of data. As you said, Laura, public health is about social, economic, environmental factors that affect our health. And so our ability to create linked data sets by linking, our census with CIHI's hospital data, et cetera, has really enabled the, rich data sources that can really study and look at public health issues from a whole range, from a true social determinants lens. And I think more recently, the focus that both us as a national statistical agency, but the government of Canada as a whole has put on disaggregated data and ensuring that when we are looking at these issues, that we are looking at the differences between key groups because that is the only way that we can to look at inequities, which Laura, you said is a key issue. So I think over the years, we've created tremendous data sources that I keep saying are just ripe for the use to better understand public health and health issues more generally. I also have the privilege in my group of having the data access function. So I think, the pandemic certainly has accelerated our technology and our ability to make these data sources more available. So we continue to make data available for free through the research data centers to academics to use, but we've moved much more aggressively in the space of virtual data. And I think we are uniquely positioned through our mechanisms like the Virtual Data Lab to perhaps be a place where we can bring together groups and data to collaborate and to use to address some of the major issues. But I want to touch on some other areas we're working on, including standards. So we did talk briefly at the beginning about quality data and standards, because as we all know, regardless of the application being AI, machine learning, basic regression models, in the end, it's about the quality data. And so, StatsCan's taken a leadership role in advancing standards around some key concepts and leading that within the government of Canada. And so we're look forward to share that information and our learnings with others so that the more standardization that we have in the data that we use, the more trust and interoperability we can enable. So, in terms of, the use of AI, or perhaps I would say more general modeling, we've had a long history in the use of modeling using microsimulation techniques under the guidance now of Deirdre and others to really help advance, in areas of chronic disease, cancer, and more recently infectious disease to use these advanced techniques to really start to understand what if scenarios. So while some of them might be more traditional statistical methods, I think we have to bring this into the conversation in terms of how we can leverage the data that we have and advanced techniques to address some of the important public health questions. I would just say from a challenge on the very specific use of AI is really having a much better grasp and understanding of how we can leverage the data that we do have with these techniques while still preserving and protecting the data. So as Jeff mentioned, we have a real responsibility for preserving and protecting the privacy and confidentiality of the data that we hold on behalf of Canadians. And I think more advances in understanding the application of AI methods in the context of these types of data sets. What this does do, though, also is open up opportunities, especially around the use of synthetic data. I know both Chris mentioned that, Jeff mentioned that. We also have a long history of developing synthetic data for some of the modeling that we have been doing. So much of the work is development of models that can be out in public, can be used using synthetic data. And I think this is an area that we need to further explore in order to ensure that we are leveraging the richness of the data we have, but in a very responsible way. Around skills and training, I think we, like every other area, every other organization today, talked about upskilling our current employees. So this has ranged everywhere from, intensive training on R and Python for those of us who grew up in a SaaS environment, but also training and upskilling our managers and executives around issues around AI and others, so that we're both, we have a level of awareness within the agency, but also understand what the great potentials and possibilities are, but where also those, areas of caution that we need to bring on. But one of the things that I think came up in our discussion in October, but we've been having this also in lots of other groups and forum, is this real need for basic data literacy. There is a tremendous need out there, I think, amongst those who are not regular data practitioners to really understand basic data literacy, the importance of data, basic concepts, the need to ensure quality. And so in 2020, we launched our data literacy training initiative with a whole slew of very basic short videos that teach the basic concepts. And I think when we talk about bringing in concepts like AI and advanced modeling, we need to ensure that we have a good grounding in terms of basic data literacy that we can then bring into and develop as we develop not just data literacy, but model literacy. And we're pleased to share the resources and the knowledge that we have around data literacy with the public health community and others, as we have been doing, with our general stakeholders. I'll say a few things about collaboration. I've said for a long, data is a team sport. It always has been, and I gather to say that, AI is a team sport. And so collaborations have been essential in terms of collaborations with other national organizations like CIHI that enable us to bring data together, collaborations with the Public Health Agency to advance some of the modeling, collaborations with our academic partners, both in terms of research and models, but this trainee that Dan mentioned, we've hosted students, postdocs, it's been critical, not only in terms of the learning of the trainees, but what we can learn from them. And in areas where we have brought in trainees in more traditional we call subject matter domain. So bringing folks who've been trained in epi or economics or sociology, we're now more and more bringing in data scientists. So folks who know these techniques to work with, teams like Deirdre's to understand how we can apply these techniques to the data that we have. Lastly, a couple of things around equity and trust. This is the heart of what we do as a national statistical agency in terms of ensuring that the information we're putting out is informative to all groups, supportive of all groups. But the trust is important. And so early on, StatCan worked on developing a framework for responsible machine learning, which we shared with the AI4Public Health. We, as part of the Government of Canada, I think Chris mentioned, there is numerous frameworks and directives around automated decision-making, and more recently, guidelines for responsible use of AI. And so I encourage us to, leverage this work and this guidance to be applied in lots of spaces. And what we have really specifically focused on as a national statistical agency is that trust factor. And so developing years ago our trust center, which is available on our website, which is really about sharing information with Canadians about how we collect and use their data to address a range of policy issues, what we do to protect it. And we will continue to use that as a place where we can share what we're doing in the AI space as we internally develop our own sort of guidance and directives around where we build. So I, love the idea of a leadership, of a training platform Dan made, or Dan suggested as well. I think a collaborative approach is what we need in order to achieve some of these goals. And if that allows us the space to identify where each organization can bring its strengths, but where we perhaps need a deeper dive in areas to really ensure that we're comfortable and moving forward in a responsible way, particularly around the use of data. I'll stop there. Thank you.
Thanks so much for sharing your thoughts, Claudia, as well as some of the concrete steps that are underway at StatCan for this work. So now we're going to go to questions. We have less time than we hoped for, but that's okay. Any of the questions that came in through the Q&A will be addressed by panelists after the talk, and we can send out our answers to you. So first up, I'm going to ask Alyssa a very specific question. So, Alyssa, you gave us some great encouragement, and you reminded us that action is now needed to push this agenda forward. So if you could speak to AI and ML technology developers, they're ready to jump into action tomorrow on some very critical public health issue. What are the most important things that they need to keep in mind at this development stage? For instance, how can we in public health, collaborate or work with them to ensure that the tools that are being built are going to be useful?
Great. Thank you very much, Deirdre. What a great conversation we've been having, and really a lot of alignment, I think, in our comments and observations and commitment and dedication to this cause. So I think we have lots of great work ahead of us, but I think also a lot of shared commitment and passion for that work. On this specific question, I think we're starting from a very good assumption that there are many people in the machine learning community that want to help with this work, right? So we see that all the time. Students who are coming through, doing a master's, doing a PhD, they want to deploy their science to benefit society and humanity. They really, they're not about, making the next algorithm to recommend your movies or generative AI art or literature. They actually want to benefit society. So there's a huge amount of interest and curiosity about how they could do that. And so I think one of the my advice to them, to the machine learning community, is if you're interested in working with the public health community, is to find ways and people and expertise and guidance to understand what are the key questions that public health experts are tackling with and struggling with? What are the challenges that we face as a public health community? And then to explore whether or not machine learning approaches are the right approaches. So let's not just develop and deploy AI applications for the sake of doing it, but actually let's solve the most critical and pressing problems within the field of public health. So I would encourage that. I would also emphasize my point earlier about community-led design. So machine learning has a long history of developing AI applications in a vacuum, and we're doing really well in getting away from that and taking a much more multidisciplinary approach, which of course is something we talked a lot about today. But this idea of putting the practitioners at the center of AI for public health applications, clinicians, public health well, I said practitioners already, but patients and people at the center of the development of these applications, I think, is really, really, really critical. So, and I know others want to jump in as well too.
Great, thanks, Alyssa. I'll hand the mic to Dan, who I think has some.
Thank you. I just want to quickly plug the importance of local public health, and that we as a country are extremely distributed. And so is our educational and training institutions, and that's a strength. And so just following on with what Alyssa said, I really encourage trainees and researchers to think about who is in my neck of the woods and how can I support them and work with them.
Awesome. Thanks, Dan. You know, I just want to share a very brief anecdote. I went to Western to visit Dan, met with the local public health folks, learned so much in 2 days. My mind was blown about, you know, what are the really critical issues that we need to tackle. So over to Chris.
Thanks so much. So one of the foundations of all of the work on AI that we are seeing in society today is it's open, right? It's open source. It has not been developed in closed laboratories. Like, folks have been able to take, adapt, iterate, and build on the work of thousands and thousands of people in this space. So my recommendation would be, like, continue that, but continue that as part of a community, right? Like, and I think potentially that this leadership group could help to shape that. But if you can find ways to, like, identify this thing, build it in the open. We've got folks from around the world here. Like, anything we're doing to improve, to protect, to promote the health of people in Canada should also be usable by other folks wherever they are. And that helps everyone. So I think, you know, open source, building community, and really finding the opportunities to come together is key.
Thanks so much, Chris. I let Claudia contribute.
Yep, thanks. Sorry, I had to unmute. Thanks for this. Yes, I totally agree. And just to pick up, Chris, on the need to develop these tools in the open for transparency, reuse, collaboration, I think this really comes back to really needing to figure out how we advance the development and use of synthetic data. Because there will always be continued, both in health and non-health areas, data that we have in our care and protection that, you know, we will not be able to deploy out into the world. And so I think this is a really important area that we need to focus on, to figure out how to do that in the best, most responsible way, to leverage the richness and enable its reuse and its use more broadly.
Thank you. I'm just going to give anyone else who wants to chime in one more chance. Okay, wonderful. So we're going to wrap up there. My final words are words of thanks. So thanks so much to Alyssa for providing us with concrete, you know, directions for action. Thanks also to Laura, Chris, Jeff, Dan, and Claudia for your thoughtful discussion today and your leadership on this file in your respective organizations. Thanks so much for the audience for tuning in. And I hope at least some of what we talked about here today is relevant for you and your organization. The seminar organization and technical support would not have been possible without the support of the AI for Public Health staff at the University of Toronto. A special thanks to Sarah, Hanako, Obadiah, and Santujan for helping me out with all the technical details. And finally, we really want to keep this great conversation going. We plan on organizing follow-up events in the fall of 2024. So stay tuned to the website or follow AI for Public Health on LinkedIn. I'm sure they have other social media as well. So look them up and check out their website. As well as the questions that we got from the audience today, we will do our best to address them and add them to the follow-up information for the report. Okay, so that's the final word from me. Thanks again for participating, and hope you come back for events in the future.